Fine, time for our sponsored segment, Plastic Surgery Today, with our plastic surgeon from San Francisco, Dr. Stanley Jacobs. Hello, doctor.
Good morning.
All right, so we're talking about the things, and this is a wide range of things that people ask you the most.
Right. This way I can avoid, answering them every day.
No. Oh, yeah. I'll ask you this and more. Number one, okay, will a chemical peel thin my sensitive skin? Now, that makes sense. Like, I have really thin skin.
Right.
But maybe it's going to shear off some.
Well, people, first of all, everybody tells me they have sensitive skin. Like, every person thinks they have sensitive skin.
Everyone's sensitive.
I have sensitive skin.
Yes.
Yeah, well, caring's okay. But the point is that in the beginning, a chemical will take off the outer dead layer in the first week.
Yeah.
So it is taking it thinner. But then the collagen is produced from underneath, so it thickens the skin in the end after 2 months. So people understand the biological power of these things is to stimulate growth from the inside, like filling up the cracks.
I think of it like a burn victim, like, you know, when you get the skin sheared off your face and then you get that scarring and it comes back.
Right, except it's not shiny because a burn is uncontrolled injury.
Right.
This is very controlled,
Yes.
so there's a difference, but the concept is kind of the same. But they think it's like stripping varnish off furniture.
Right.
And then you get the raw wood.
Skin grows,
But skin grows, and it thickens more. So people always say, I can't have a peel because my skin's too thin. No, those are the people that should have a peel.
Okay.
Because it will thicken it by underneath building it up for collagen.
Okay.
Yeah, that's a fallacy.
What is nasal packing? Ooh, in nose, it sounds like you got a bunch of cotton swabs up there.
Well,
is that what that is?
Historically, people have packed noses in surgery to prevent bleeding after nasal surgery.
Yeah.
And a lot of people still do that today to prevent a septal hematoma, it's called. But if you use a suture...
I hate that, a septal hematoma.
I hate that.
Yes.
I scratched it off my list. No. But if you put a suture through the septum, which is the middle part of the nose, and it dissolves the suture, you prevent bleeding and swelling or hematoma.
Okay.
So you don't have to pack people. Like I did a rhinoplasty yesterday. She has no
They're
patch.
not going home with all that stuff in there.
Yeah. So
don't
if your doctor suggests nasal packing, say, can't I get a quilting stitch of my septum, a suture that dissolves, and forget the packing.
That sounds good.
That's what you want.
I love this. Will exercising my facial muscles reduce wrinkles? Because I thought, isn't the whole idea of Botox so that you don't go smiling and do crazy things? Wouldn't this, if you exercise, will they give you wrinkles?
Yes, and there's some machines that you put on that have stimulators that like electric current, little buzz.
Yeah.
They go zap, zap or whatever.
Yeah.
And it's supposed to tighten your muscles. The problem is that it makes it worse because it's pulling at the skin underneath.
Don't pull, don't mess with your face, right? And that's bad for
They're
wrinkles.
selling these things, and people think that also if they do this, it's like lifting weights, you get a big bicep. It's not like that. Your muscle may strengthen, but that just shears your skin. And you don't want that. There's a glide plane where the skin glides over the muscle. The muscles keeps pulling, while the skin keeps indenting.
Right.
So don't get those.
I gotcha. Okay.
Yeah.
Okay. Well, I was thinking of a way, like we were talking about things buzzing, and you could like slap your face a little, it gets a little puffier, and then your wrinkles don't look so bad. That's my own question. Does that sound good?
If you want to slap.
No, not a good idea.
Not a good idea. No.
But you said it would look good for like maybe a half hour if you didn't bruise yourself.
Yeah.
It's at-home plastic surgery.
Right.
Forget it. All right.
Forget that.
What is hyaluronic? Am I saying that right?
Hyaluronic acid.
Hyaluronic acid.
Right. You're going to hear a lot about that because that's what's in Restylane.
Yeah.
And what's in Perlane and,
Oh, that's
Juvederm.
injecting stuff.
It's injecting
I
stuff.
thought it was the stuff on the skin. No, injecting.
No, it's injectables like Juvederm, Restylane, the fillers.
Right.
It turns out that hyaluronic acid is in your skin anyway, and it's in the umbilical cord, the jelly stuff. That's what it is, but they synthesize it.
So it's no longer, people aren't putting collagen in their faces anymore.
It's that's kind of passé.
So you put this in there.
Put this in there. Now your body, it's natural.
Yeah.
So you don't usually react to it, but it degrades it, but it looks natural.
I see.
But people need to know that term because you're going to see a lot more in the press about hyaluronic acids.
Why?
Because of these products, because it's a common product, because there's so many of them.
Right.
And that's what's in them. It's a common thing between most of these fillers today.
Yeah.
But it's a naturally occurring product that they're able to synthesize in a lab.
So you like this? You think
it's a good product.
Because collagen, I remember you could see people with like bumps and stuff.
Well, collagen doesn't last very long. Collagen lasts, maybe a month or two.
I see.
And it breaks it down. It was usually cow collagen or bovine. This is synthesized in a lab, so you don't have to worry about antigens, cross-reactivity, your body responding and reacting to a foreign antigen. You don't have that issue.
Okay, very good.
Yeah.
Thank you, doctor.
You're welcome.
If you're interested in asking any more questions to the doctor, you can call him at 433-0303 or go to his website at drstanleyjacobs.com.